So, today we're going to talk about formulating diagnosis, a look into assessment and diagnosis. So, the learning outcome for today's lecture is after this presentation, you should be able to define reliability and validity and know the difference and importance between the two of them. Also, discuss why reliability and validity are an important criteria for the DSM-5, and discuss the important information therapists look for during the initial assessment between a therapist and client and why, and discuss the limitations of assessment and be able to discuss possible solutions and discuss ethical factors of using diagnostic labels. So the assessment process is basically the process that therapists use to help improve the client's state, and basically in that they measure a reduction of the problem and how the treatment is going to help them. A therapist cannot jump to conclusions whether it comes to diagnosing their patient. It takes time, and they have to use their current level of psychological functioning to understand where the patient is currently. For example, if a patient has social anxiety, the improvement would be measured by experimenting and having them and studying them and seeing how they are when they go out socially, and which would be a reduction form from their normal social anxious behavior. And the initial assessment. So the initial assessment goals are to understand the needs of the client, get a thorough patient history from the client, and to become more comfortable with your client, to understand all the symptoms they may have experienced, and hold a structured and unstructured session with them. So what do therapists look for? So typically a therapist only has 15 minutes to conduct an interview with their patient, and this is the most critical part of the entire journey, because in those 15 minutes they have to figure out what is the issue with their patient. So that's when the therapist can use structured and unstructured questions to allow them to get more information about their patient. So a structured interview would be an interview with strict guidelines that they have to follow, versus an unstructured interview, which are all basically just open-ended questions, and the patient has to talk to the therapist when the therapist just sits there and listens, versus structured when there's strict guidelines that have to be followed. And some questions that may be asked are: why are you seeking therapy? What is your current history, your symptoms, and your current mental status, and the severity of your issue. So the limitations of the initial assessment are basically the doctor trying to figure out what the client is comfortable with or not comfortable with information-wise, and how accurate their information actually is, and to see if the therapist is able to build a strong connection with their patient, to see if they have a common ground they can talk about. And the solutions of these limitations are that the patient needs to be truthful with the psychiatrist from day one, so that way their treatment goes as planned and it can be more beneficial to them. And the therapist already should be trained to assume that all patients may not be telling the truth, but they would know how to handle the situation. And going back to the point whether they're structured or unstructured interviews, the therapist should have the appropriate questions already ready for them. And continuing with the initial assessment, so a diagnosis is the most important part of this whole process, because with a diagnosis, you need to be able to figure out what the problem is and how to come to a solution with that. So diagnosis is like the bridge point of whether what treatment we're going to go with and what your issue is. And once that diagnosis has been made, then the therapist is able to treat their patient with the appropriate care that is needed. A diagnosis is important because it provides a clear statement of the client's dysfunction, and the scientists they have many resources that can be used in order to come to this conclusion. So this brings us to the DSM-5. So the DSM-5 is the American Psychiatric Association recognizes the Diagnostic and Statistical Manual 5 as the official source of scientific literature for the psychology community. It is judged by its reliability and validity. So basically, validity refers to how well the authorization measures the intended value and how general the results are. And reliability refers to how consistent the results come out to be. What is reliability? Reliability ensures that each time a certain procedure is carried, the outcome will be the same. So a scenario that comes into play with reliability is that, say that someone suffers from PTSD, then one of the treatments for PTSD is therapy. And you do therapy for a certain amount of time until you see results. And once you start seeing the results, then you can slowly ease off of it. But if that PTSD was to spur up again, then the patient needs to have the certainty that if they do go with this treatment again, that they will get the same result. And validity is the test that accurately measures what is initially claimed to be measured. So validity is determined by numerous factors that sufficiently demonstrates the relationships between the test and the outcome that is intended to measure. So an example of validity is that if a test claims to measure how humid it will be outside, but in reality it actually ends up measuring how likely it is to rain, then the test is not valid. So in order to make something valid in this situation, the test would have to measure how humid it is, not how likely it is to rain. So why is reliability important in the criteria for the DSM-5? So reliability is an important criteria for this because it allows the researchers to identify accurate factors associated with these behaviors that the patients might experience and some of the symptoms that are specific for this. So an example of this would be patients with PTSD and their symptoms, and how the risk factors and the behaviors are all different for everyone. It's also essential for validity because it helps the researchers to see how accurate the risk factors are, to see how valid it is. It's also important, continuing for that, is that it allows clinicians and researchers to accurately predict the characteristics and behaviors regarding specific mental disorders. And an example of that would be, say that Emily goes to a therapist who uses this model, and she shows characteristics of having social anxiety, and she was diagnosed with social anxiety. And if somebody else goes to a therapist using that, and they present the same behavior and characteristics as the first person, and she too gets diagnosed with social anxiety, the DSM-5 needs to be conclusive and valid enough for each disorder listed so the therapist can make correct diagnosis. So the ethics of diagnostic labels. While it is customary for therapists to diagnose patients with labels, there can be ethical concerns regarding this. So some of these labels may make the patients feel uncomfortable and not want to be labeled in a certain way because the way society is today, labels always come with stigmas. And many of these labels have a negative feedback, so they don't want to be social outcasts and be given a negative label. So with that being said, when a patient gets diagnosed and they're unhappy with their diagnosis, then they automatically assume there's something wrong with them. So that's why we have to be careful when we do diagnose a patient with a disorder, that we assure them the full meaning behind it and not just give them a name to it. We need to discuss what goes into it and be ethical about this. For example, when somebody gets diagnosed with depression, they would blame themselves for this and think that they did something wrong, when in fact it's just due to a chemical imbalance in their brain. And in reality, they did nothing wrong. So this is when we have to choose our words wisely when we do diagnose a patient with this diagnosis.